It is your last chance to make changes to your Medicare plan for 2023. Dr. Meena Seshamani is here with more. We want to ask you right away, we've been hearing a lot about Medicare open enrollment, but when does it end?
Thank you so much for having me. And I'm thrilled to be here today because Medicare open enrollment ends December 7th. So for everybody listening, there is still time to review and compare Medicare plans. And it is so important to do this each year to make sure that you have a health plan that best meets your needs. And it's important to do this before December 7th, because after that point, people with Medicare will have to wait until next year's open enrollment to find a health plan that best meets their health needs and their budget.
That's what I was going to ask you. What happens if people miss that deadline? They have to wait an entire year before they can do it again?
That's right. They would have to wait an entire year for next year's open enrollment. And that's why it's so important for people to go and look at what their options are. Because even if you're happy with your current coverage, there may be a better fit for your health plan, for your health needs, and your budget. You could save money, get better health coverage, and better quality.
And why is this especially important for people with Medicare?
It's so important because people's health needs change every year. What plans offer change every year, and your budget changes each year. So being able to go, even if you're happy with your current coverage, being able to go and compare plans, you may find something that offers you better coverage and saves you money.
And how do we go about comparing those Medicare plans?
We have tried to make it as easy as possible. You can go to Medicare.gov. That's Medicare.gov. Click on Find Plans Now. You can input the prescription drugs that you take and get a side-by-side comparison of plans based on their coverage, their cost, and their quality, so that you can easily see the differences among the plans to make your choice.
That's really
If you want to choose a new plan for 2023, you can enroll right there. But if you are happy with your current coverage, then you don't have to do anything further.
That is really helpful. Also, I have to ask you, with diabetes being so common, talk about the new insulin benefits for the upcoming year.
Yes, great news. Thanks to the new drug law, starting January 1st, people with Medicare who take insulin will not have to pay more than $35 for a month supply for each covered insulin product they take. So it is so important to look into this, and we encourage everyone taking insulin to call us at 1-800-MEDICARE. I mentioned the website before, Medicare.gov. We also have 1-800-MEDICARE, where we are available 24 hours a day, 7 days a week, to help you to figure out what plan best fits your needs.
Great. And if we go to that website, that Medicare.gov, or we call that number, they're going to help walk us through this process because it can get a little overwhelming.
Exactly. And it's also important, we mentioned people with insulin. There's also opportunities for financial assistance for people who are lower income to help pay for prescription drug costs, for doctor's office visits. So call us at 1-800-MEDICARE and we can help you figure out if you might be eligible for that financial assistance as well.
All right, doctor, thank you so much for being with us. We really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.